Welcome to HCA Talks Health, brought to you by Health Coaches Academy, the UK's leading health coach training academy. I'm your host, Zina LaRue, a certified health coach, and each fortnight I'm joined by experts from across the health and wellbeing space to share insights, ideas, and practical tips you can use to improve your health and everyday wellbeing. Today, I'm joined by Dr. Louise Oliver, and we're talking about breathing efficiency. So Louise works as an NHS GP and also works privately as a functional breathing practitioner and a therapeutic life coach, teaching others to breathe as nature intended. So welcome to the show, Louise.
Thank you very much for having me.
I want to start with your own story, and I know that breathing changed your own life. So please tell us more about that.
So I thought I had nothing wrong with my breathing at all until I hit my perimenopause and I essentially became a snorer. And I really couldn't understand why. I wasn't overweight at all. But actually, in retrospect, I now know I probably stopped breathing as nature intended when I was 10, and my breathing probably got deteriorated without me sort of knowing it. I was still running 3 times a week, so I didn't think there was an issue with my breathing, but clearly I was snoring. So my unconscious breathing pattern is not as nature intended. We're not designed to snore. I did go on HRT. I got some benefits from that, but it didn't stop my snoring because the issue wasn't a lack of hormone. My issue was I wasn't breathing efficiently. And then when I corrected how I was breathing, then my snoring went away and my sleep's the best it's been in years. My body just is functioning better, but I can exercise with greater ease. I recover quickly from that, and I just feel calmer. So I'm really passionate that others understand this.
Oh, okay. So what do you mean by how nature intended? So how are we supposed to breathe? Tell us more.
So if we with the human body has been beautifully designed to breathe, so it's really efficient. You know, every cell, organ, system in the body is just working just in unison. But remember, the human body was designed years and years and years ago, and how were we living at that point? We were outside, closely knit as a tribe. We woke up when the sun set. We went to sleep when the sun set. We ate an unprocessed diet. We moved a lot. There wasn't hardly any stress. There certainly wasn't any electronic devices. So all of that would have promoted healthy breathing. But we don't live like that now. So we're not necessarily living as nature intended. And essentially, you know, we start to, one of the easiest ways to work out if someone's not breathing efficiently is you start to use the hole that we're not meant to use. The nose has all the features
Yeah.
required for breathing, but the mouth doesn't. And then just that simple switch, as soon as you switch to mouth breathing, you're then starting to use your body in a different way.
Mm. Okay, so are we always supposed to breathe through our nose, never through the mouth?
So there's nothing in the mouth that assists breathing. Okay, it's chewing, laughing, talking. The nose has all the functions, so it acts as a filter. It warms the air, it moisturizes the air, it can extract a lot of particles, not the very tiny ones. It creates a pressure gradient for the air to come in. So all the functions are there. And actually, the nose is connected to the brain, and the nose is actually connected to our memory center and our amygdala. It's to do with our emotions and fear, etc.
Mm.
So the nose is associated with health and well-being, but the mouth is a secondary backup mechanism that it's there for in emergencies, or maybe at really high levels of exercise.
Mm.
Um, then switching to that, there will have been some survival advantages probably to us switching to that. So and it does depend. I do all my running now. I've trained my body. I do all my running. I live in a hilly area, and I manage to do all my running in and out of my nose. But that does depend on the amount of exercise you're doing, the intensity, but also your nasal cavity size. We all have different nasal cavity size. So the smaller it is, and I don't mean the nose stuck on the front, I mean the nasal cavity behind, that will very much dictate whether you can maintain nasal breathing at high levels. But generally, asleep in and out of the nose, whilst you're at rest, in and out of the nose, and at lower levels of exercise, if you've got efficient breathing, you should be able to breathe in and out of the nose.
So the mouth is just there for emergencies. It's like a backup. But
Yeah.
would you say that most, or there are many people out there who mainly breathe through their mouths?
Yeah. I
Maybe.
mean, one Saturday afternoon, I stood outside the supermarket for 5 minutes and I marked off on a piece of paper how many people were mouth breathing, just walking very gently. No one was in a rush, and it was 50% of people had their lips open. Now, if
Oh.
your lips are open, I don't actually know whether you're nose breathing, mouth breathing, or mixed breathing, but I was measuring how many people had their lips sealed, so I knew they were nasal breathing. So 50% weren't.
Mm.
Um, and when I go into my waiting room to collect my next patient, not so many are nasal breathing. Perhaps the ones I've spoken to them about it will have their lips sealed, but it will be more than 50%.
And what do you think the reason is for this? Why do people tend to breathe through their mouths?
People have just not been taught it. They just don't. Most people don't understand um, how we've been designed to breathe. The more ill health that we have, we're more likely to start to breathe more inefficiently. Hormonal changes. We have hormone receptors, sex hormone receptors all around our body, including our lungs, diaphragm, which is the main breathing muscle under our lungs, tongue, breathing center. So it absolutely makes sense that hormones impact breathing. Um, but we don't talk about it. So menstrual cycle, puberty, pregnancy, menopause, breathing's going to change. And unless somebody's told you the importance of how you breathe, you wouldn't know. And the issue I see is if people get a blocked nose, maybe they get a cold, they mouth breathe because that's just what happens. But the trouble is, the more you mouth breathe, the more nasal congestion occurs. So it becomes a slippery slope
Mm.
that you start to mouth breathe, your nose becomes congested, and unless someone's told you you need to do something to sort that out, you just start to mouth breathe.
Mm.
Um, so
So did you just get up one morning and decide, I mean, after obviously working through the content or getting, being aware of the impact, to start nose breathing? Was it that simple?
No, it wasn't that simple. No, because at age, I think what happened with my breathing, age 10, unfortunately, another pupil in the playground told me that my stomach looked big and recommended that I suck my stomach in to make it look flatter, which I took that advice and basically walked round with my sort of stomach sucked in for 35 years. Um, and unfortunately, she would have just, I've no blame, she would have been told or by a older sister or a mum or whatever. And it's just society's expectation that the stomach's meant to be flat. But the trouble is, if you suck your stomach in, you're less likely to breathe with your diaphragm, so your main breathing muscle under your lungs, and it's a muscle. If you're not using it, it gets weaker, and then your breathing becomes into your upper chest, and then you start to use the muscles that are meant to be there for an emergency. So I was trying to unpick 35 years of breathing. So, but if anybody out there is finding thinks it will be difficult to change their breathing, what I always say is, if you reckon, if it's easy, if it's just a case of, oh, you're meant to breathe through your nose, oh, I've forgotten about that. Oh, right, yeah, just lip sealed, breathe from a nose, have a reasonable posture. Um, you probably won't feel any different because it's that easy to change. But if it's really difficult to change, you're going to have to reprogram your unconscious breathing pattern so it becomes unconscious. That's an effort. And the harder it is to do, the more life-changing it is. So I always say to people when I work with people, sometimes sometimes there's a moment where they recognize how compromised their breathing is, and it can feel quite overwhelming for someone to actually feel I didn't realize I was breathing this inefficiently. But I always say, like, be grateful. Come on, you at least you recognize you're not breathing efficiently. You actually want to improve it. I'm here to help you. And actually, I can definitely say the harder it is to change, the more life-changing it's going to be. So that, that changes the perspective on it. So.
And it's definitely been life-changing in your life. So you've mentioned better sleep. What else? What else changed for you?
Oh, just everything. I mean, like I definitely feeling calmer. There's no way I could cope with the amount of tasks and pushing myself out of my comfort zone. I became a doctor to help others. I had no ambition or drive or want to be on podcasts, to be contributing to books, to be presenting at conferences. I wanted to be a doctor to help others, and that was it. I'm not a natural public speaker, but I've had to push myself out of my comfort zone to do that. Um, and being able to breathe efficiently has really been very powerful for me. So I found it extremely, I can cope with so much more. Obviously, if you push enough buttons, I can still explode, but I can cope with a lot more. And just the sleep. I mean, everybody knows if you can sleep well, and obviously now I think I'm post-menopause. I hear so many post women around the menopause who say their sleep goes crazy, and obviously I don't boast, but like my sleep is just amazing. And everything just works better. Your gut works better. My skin, um, you know, um, I just feel like I've got more energy and more focus. I just feel like my body can function. So it's just so much better.
So when we're thinking of the traditional sense of the idea of breath work, is that something that will serve someone who is mouth breathing typically?
Okay. So breathing's really complicated. And actually people think because we do it unconsciously, it's really easy. And actually it isn't because we've if we stop breathing, we don't survive, we die. So the body has all sorts of backup mechanisms to keep us breathing, and it's really complicated. If you can imagine breathing just with our lips sealed in and out of our nose, but can you imagine our breathing still has to continue when we're eating and talking. So there's different aspects to breathing. Um, so breath work. So when I really want people to really respect breathing, because when you deliberately change how you breathe, you have the power to change, if it's your own breathing or somebody else's, you have the power to change their biochemistry, their physiology, and actually even their anatomy. So you're like hijacking their body. So first of all, I would say I think the person who's teaching that person, the person who's having their breathing change, actually should understand the science
Mm.
and actually what do you want the outcome to be? And sometimes what I'm seeing, particularly in the breath world work, is not always do I see the science matches what the intention is because it's complicated. I have an added advantage. I'm a doctor, I understand basic science, and I've had a lot of experience with patients. I've been a doctor nearly 30 years now. So, but what do you want the outcome to be? Every time I speak on a podcast, I work with somebody, my outcome is I want someone to be breathing efficiently. And if they're not, what I'm telling them is helping them to breathe more efficiently. So everything I will say will be aimed to that.
Mm.
Um, there may be somebody might have a different aim, um, and the outcome, you could take the same breathing method, and the outcome that occurs in someone who's breathing efficiently and someone who's breathing inefficiently can be very different.
Mm.
So
Mm.
if you say the common one I hear is breathe in for 4 and out for 6. So that should induce generally a relaxation response. But often the instruction is just given as that breathe in for 4, breathe in for 6. There's no instruction. Is it in through the nose, out through the mouth, in and out of nose, in and out of mouth? Is it a big breath? Is it a silent breath? There's no instruction around that, and that completely changes it. If you take someone who's got inefficient breathing, so that was me, and when the yoga instructor was saying that in a class, it induced a stress response. But she was telling me it was meant to induce a relaxation response. I couldn't understand it. And it was because my baseline was so poor, my body couldn't sustain that. And it induced a stress response.
Okay.
Whereas if you're efficient, then it would induce the relaxation response. And now I can it's probably too fast for me to breathe like that now. I want to breathe even slower. It induces a profound relaxation response, but the subtleties are just not there. And you need quite an understanding of science and an ability to work out how someone's breathing to establish that. And you can't get that across in a 30-second, 60-second social media reel.
Yeah, exactly. So breathing efficiency is something completely different compared to breath work, right? So breathing efficiency is basically breathing through your nose, while breath work could be anything. It's just getting
Yeah.
in and out of your body somehow.
So breath work probably generally applies to you're changing your breathing within that moment to do something. So and I suppose my I do breath work with people because I'm asking them when I'm trying to reprogram their unconscious breathing pattern, I'm asking them to do certain breathing exercises. So that could be classed as breath work. But
Mm,
my whole ethos is to try and improve that unconscious 24-hour breathing pattern.
yeah.
Um, but whereas someone might just say do a breath work to just feel different in that moment, whereas I'm doing it with I really want to retrain your unconscious breathing pattern.
Yeah. So just in general, I mean, you've mentioned that example of breathing in for 4, out for 6. So would it be efficient breathing if you breathed in through the nose and exhale through the mouth, or should we be exhaling through the nose as well?
Okay, so this is a really good question. So this I'm going to demonstrate on our bodies. So there's actually 3 dimensions of breathing. Okay, so if we say let me name them first. So the biochemical, the biomechanical, and the psychophysiological. So the best way to remember it is breathe light, breathe low, and breathe slow. So
Mm.
breathe light is about, are we breathing the amount of air we need, or are we over breathing? Breathe low is about, are we using the correct biomechanics, so basically the correct muscles and ligaments to breathe. And psychophysiological is breathe slow. So basically, when we breathe slow, it's absolutely brilliant for mental health and all our unconscious processes. Um, and in and out of the nose is how we've been designed to breathe. Um, and there's subtleties in that, and it changes it. And what I find is if someone's over breathing, so I was definitely over breathing, you find it very difficult to breathe with the diaphragm, to breathe low and breathe slow, because you're asking someone, if someone's really over breathing, it can be subtle. When you ask them to breathe low and slow, they can't do it. They get a stress response. So if we let's demonstrate. So if we put a hand on our upper chest and hand on our upper tummy, have a reasonable posture. So posture does make a difference. So imagine you've got a string at the back of your head, gently pulling it up. And then let's just start to breathe with our mouth. So if we start to breathe with our mouth, in and out of the mouth. Right, I can see your shoulders move and mine. Okay, so we've gone high because our shoulders are moving. Okay, I can hear you breathe, and so can I. So we've gone heavy. Okay, and I've gone faster than I was breathing. Okay, so I've gone higher, faster, and heavier. That actually turns up the stress response. Okay, now keep that posture helpful for breathing, and just gently, if you're able to, close your mouth and breathe in and out of your nose. So you've gone quieter, so you've gone lighter. Your shoulders aren't moving now. They've stopped moving, so have mine. And my breathing rate's gone slower
Mhm.
as yours. Yeah. So by breathing in and out of the nose, we've both gone lower, lighter, and slower. That induces the relaxation response.
Mhm.
Now, if anybody felt a stress response doing that, that may be that you've got inefficient breathing and you can't sustain what we've just asked you to do, which is breathing in and out of the nose. And I would say that most likely is because you're over breathing, which can be corrected. Now let's just change it. So go. So still the helpful posture for breathing, like you've got that string at the back of your head, gently pulling you up. And now breathe in through your nose and out through your mouth. So I can hear us both breathing. So we've gone heavier. Your shoulders have started to move again. And then we've both gone faster. So just that one change, breathing in through your nose and out through your mouth, we've gone heavier, higher, and faster. So you're actually generating more of a stress response.
Okay, so it's all about the nose, in and out. Okay, so I mean, there's like you said, there are strategies that you use with clients to help them to become more efficient at breathing. And I think that's the kind of the conscious part, I guess, of
Yeah.
training you to be able to breathe in a certain way. Is that what we just did together to be able to make sure you breathe in and out through the nose, slowing it down, slower, all of those things. Is that basically the conscious part of the breathing efficiency?
So there's different aspects to it. So we first of all, so for me, I have a very holistic approach of trying to correct someone's breathing pattern, and we've got to think we're breathing through a tube that's collapsible in our neck, and that tube we've actually everybody's got a different size tube depending on your anatomy, but these different aspects change that. So I'll rattle through them quickly. And all these I teach someone. So it's really important to have the tongue in the correct position, lips sealed, breathing in and out of your nose, having a helpful posture for breathing, but strengthening the muscles that are connected with breathing. So we talk about if we're not strengthening muscles, muscles get weaker. But how often are we talking to people about strengthening the muscles around the collapsible part of the airway? And how often are we talking about strengthening your breathing muscles? So my breathing muscles were extremely weak, and now they're much stronger. So there's all those different aspects. But the main thing that I find life-changing that I think we miss out in a lot of breath work, information that I see on social media is if somebody's over breathing. Now, if someone's breathing in excess of what they need, and as soon as you switch to mouth breathing, on average, you'll be breathing an extra 800 milliliters of air per minute. So that's a pint. So I can't remember, is that about 600 mils? So it's bigger than this glass that I've got per minute. And you're throwing that through an airway here. And the only way that I can see to correct overbreathing is you practice breathing exercises, which in the moment you underbreathe, but not in a sense that that would cause any stress response, but you're training your body to underbreathe in that moment. So then it allows your body to recalibrate the rest of the time. So a lot of the breath work that I do initially is to correct overbreathing.
Okay.
But it just has to be done in a way that obviously doesn't cause any sort of stress response. And then the body just does its thing and then recalibrates what you need. And then nasal breathing becomes, if it's difficult for someone to establish it, generally the nose opens up and it's easier then to nasal breathe.
Okay.
And then I work on strengthening muscles and practicing breathing slowly and things.
Have you ever wondered whether you could turn your interest in health and wellness into a meaningful career? At Health Coaches Academy, we train people just like you to become professional health and wellness coaches through our Level 5 diploma. It's a 12-month part-time course, fully accredited, and designed to give you the skills, confidence, and practical knowledge to help others transform their health while building a career you love. If this sounds like something you'd like to explore, visit healthcoachesacademy.com. Now, back to the show. Okay, so it's quite a comprehensive process to be able to correct it. Mm.
If someone's only just got a mouth breathing habit, it's dead easy. Just get your lips closed and just practice your dog walk with your lips sealed in a reasonable posture,
Yeah.
and your tongue in the correct position. That's fine.
Yeah.
That's easy. But I work with individuals, I think eight is the. I've forgotten how old my oldest client. I've just finished with my oldest client. I can't remember how she was. She was about 80. I'm working with someone who's 70, who's probably it was teenagers when she stopped. So I'm trying to unpick 60 years of inefficient breathing.
Wow.
And she's getting improvements. So there's no age barrier to this. If you're willing to put work in, it gets more complicated because you have more health problems at that point in
Yeah.
life often. You just got to adjust things. But yeah, no, we're getting some great results. So we just got to be gentle. But yeah, so if we're unpicking 50, 60, 70 years, that's
It's
more effort.
lovely. Yeah, okay. But what about at night? So many people sleep with their mouths open. Often we have quite a bit of a laugh when we see someone with their mouth lying open sleeping. But what can someone do about that? Because obviously it's not a conscious decision. So what to do?
So there is nothing helpful, and I really mean this very strongly. There is nothing helpful um, for breathing in and out of the mouth when you're asleep. You're drying out your airways. You're irritating your airways. So if you've got, asthma, COPD, any sort of lung conditions, you're actually making cough and wheeze more likely. You're over breathing, so you're starting to bring extra air in and out of your body. We've demonstrated when we went to mouth breathing, we're not breathing with our diaphragm. The diaphragm actually it helps assist move the blood around your body, the air in and out of your body. The lymph fluids, that's our waste fluid, it actually assists moving that around our abdominal cavity and thoracic cavity to remove that. But also, breathing with the diaphragm assists the movement of fluid around the brain and spinal cord. So when we're asleep, our body should our brain should have like a dishwasher system. So it's called the glymphatic system. So it's got a G in front of lymphatic. And when we go into the deeper stages of sleep, essentially our body feels safe and this dishwasher system turns on, and basically our toxins are removed from our brain. But the diaphragm has a role in that because it creates pressure changes when we breathe through the diaphragm and it assists the movement of that fluid. So if we're not breathing using with our mouth closed, we won't be using our diaphragm as much and we're impacting that. And even worse than that, mouth's open, tongue's too far back, you have narrowed your airway. You're making it more likely to snore and more likely to have that condition where the airway blocks um, or makes narrows, called obstructive sleep apnea. And there's lots of health risks associated with that. So there's nothing helpful with that. Um, Clearly, how you breathe when you're awake impacts how you breathe when you're asleep. So if you're mouth breathing the entire time when you're awake, clearly you're not suddenly become a nasal breather when you're asleep. So thinking about how you breathe whilst awake is really important. But sometimes it's just a habit. Um, and there is a product I recommend that I can show you. Um, there are lots of talk about mouth tape. The issue is if you've got obstructive sleep apnea, so that condition where intermittently when you're asleep, that collapsible tube is closing or significantly narrowing, that the body generates a fight flight response, a stress response to open it. Having the mouth completely sealed or a tape that has a tiny hole potentially is dangerous. And if somebody is particularly over breathing, they cannot shift that amount of air in and out of their nose quick enough to uh, to basically maintain breathing. And if you've got nasal congestion, etc., etc. So I use a product called MyoTape. So
Yeah.
MYO tape, MyoTape. And it was created by Patrick McEwen, who I did my breathing training with. And it's I describe it not as a mouth tape, it is a product that encourages nasal breathing. So it means that somebody can still mouth breathe if they can't sustain nasal breathing. They're very, very light, like this, and you would stand in front of a mirror, put your lips how you would want them to be. You stretch it, it's got a massive hole in the middle, if you're listening, and you stretch it by about 30%, and you put the tape above and below the lips. And then just make sure, putting a bit of heat from your hands to make sure the glue sticks. And because you've stretched it by about 30%, it's then just gently bringing the lips together.
Okay.
But if somebody is over breathing or just needs to mouth breathe for a bit,
Okay. Yeah.
there's no restriction. So
Mm.
at the beginning of the journey, sometimes I have clients that say, "Oh, I'm still breathing through it." But I say, "Well, that's exactly why you're using that tape, because at the moment your body is not capable of sustaining nasal breathing when you're asleep. When your body's adjusted and can do, you will be able to nasal breathe." And if anybody wants a discount code on that, the my discount code is Louise Oliver 5. It's all caps lock. Louise Oliver 5 on Oxygen Advantage, and you'll get a little discount there. But that's the only product that I recommend because it's safe, and I know that people can override it. Obviously, if they've drunk alcohol or they're on drugs that were sedating them, I recommend not using it.
Yeah. So I guess this product is only available in the UK, right? Not in South
Oh
Africa.
no, no, it's global. Oh, yeah,
Okay. Okay.
yeah, yeah,
Okay.
yeah, yeah.
Fantastic. Yeah, so it's quite interesting for those who are listening that it actually the mouth is still open, right? And it, like you explained now, it just kind of brings or encourages the lips to come together. But if needed, then someone can breathe through their mouth, so they don't go into a stress response because that is potentially dangerous. So, yeah, very interesting. So you've mentioned a few times now how posture impacts our breath. So I'm curious as to how looking on our phones all the time or a screen, whether that could also be impacting the way we breathe or how efficiently we're breathing.
Oh, definitely. So if we just can we just go back to what we were doing
Yeah.
before? So one hand on your chest and one hand on the upper tummy. So we've already established that if we breathe in and out of our nose, that's going to make us breathe lighter, lower, and slower. So that induces more that relaxation response just at rest, which is what we want. So if we're just sat there with a helpful posture, so imagining that back of your head, little string just pulling you up. So if we're breathing in and out of our nose, and now just round your posture as you breathe in, and just still breathing in and out of your nose. So for me, by going forward, I can hear myself, my shoulders are starting to move, and I'm going faster. And now come back up to a helpful posture.
Mm.
Could you feel the difference in your
Oh,
breathing?
huge, huge.
Yeah.
I was
And
even
the issue is when you do that, not only is it changing your whole breathing, so you're breathing now higher, faster, and heavier, so that's generating a stress response, but we've now compromised our main breathing muscle. And if
thinking.
you sit for eight hours with your compromised breathing muscle, you're not using it, it will get weaker.
Okay. So another reason to be wary of the screens, hey? We know all the other detrimental effects, but here's another one. Okay. So as of course you've been trained as a functional breathwork practice or effective breath. No, please help me.
Functional breathing practitioner, yeah.
Functional breathing practitioner. But as coaches, as health coaches, we don't have the same knowledge, and obviously we can't go on the same journey as you would with a client. But what would your recommendation be as coaches, how to start working with clients when it comes to breathing, or what to do, or where to start?
Yeah. So just observe them. Just, really simple. You can use you can I think it's really powerful just to sort of get them to notice their breathing. But just if you just think if their lips are sealed, their nasal breathing, and if they've got helpful posture. So because that in itself can just make a massive difference. People just haven't put any thought into it. So have they got their lips sealed? Are they breathing in and out of nose? And just often it's we need to just go further back. We need just imagine that little string at the back of your head, just gently pulling us up.
Mhm.
And that in itself can just work wonders. And then encouraging someone that, if they're walking from the house to the car, they're on their dog walk, they're watching the TV, just intermittently coming back. Are they breathing in and out of their nose? Just intermittently. Um, the other thing is asking somebody how they breathe when they're asleep. Obviously, if it's just a simple mouth breathing habit, correcting that in the day and when they're asleep by perhaps wearing MyoTape might sort it out. But if there's a spectrum of what we call sleep disordered breathing. So, and that's just a term to say you're not breathing as nature intended when you're asleep. And one end of that spectrum is your mouth's open.
Mm.
Another end of that spectrum is the obstructive sleep apnea we've already discussed. And in between, it's snoring, heavy breathing, that type of thing. And it's a sliding scale. Clearly, if somebody's got obstructive sleep apnea, it's still important for them to have an efficient breathing pattern, but they might need other treatments. They might need a sleep test to investigate that, to get a diagnosis, and they might need treatment such as what we call a CPAP machine or a mandibular advancement device. But I've worked with individuals who have these devices and they do much better outcomes if they've got an efficient breathing pattern. So I see it as complementary. But if somebody's saying to you that they stop breathing during sleep, they are heavily snoring, that you can hear it from another room or on another floor, they have a really significant problem. They should see their health professional. They can still work on their breathing efficiency, but they might need investigation and treatment.
Okay. So I know you've mentioned quite a few things, but I'm still interested. Is there something that someone might be surprised about if they think, I've been struggling with this, some health issue or concern, and that it might actually be linked to inefficient breathing?
So this is what I love about the job that I do, my private work. Because breathing affects every single cell, system, tissue in the body, you could literally give me any symptom, any medical problem, and I could tell you that breathing could be negatively impacting it. But that doesn't mean by correcting it or go away. So what is always really fascinating is what I say is at the end, when someone's improved how they breathe, they can look back on what's disappeared or improved,
Yeah.
it was related to breathing. And the three common ones would be sleep improves, exercise tolerance improves, and they feel calmer. That's fairly sort of standard. But I've had people smell again. So I did a group course and three people on it started to smell again. One of them had been told they were never going to smell again by an ENT surgeon. They'd not been able to smell for 18 years. Passing urine in sleep. I was told I would stop passing urine to get up to go to the loo to pass urine. I did not believe that, but I don't pass urine anymore, and that's again quite a common one. Um, I've had people whose bowel functions improved.
Mm.
I've had one recent lady who had an overactive thyroid and was probably going to end up having radioactive therapy, but at the moment her blood tests have normalized and she doesn't think she's going to need that. Could be coincidence, but if your body's in less of a stress response, it does help thyroid. What else have I had? Oh, pain definitely better. Because if you're not using the right muscles, pain is definitely better. Gosh, what else am I trying to?
You've mentioned the brain, right? So there's lots of benefits to the brain.
Oh, brain fog.
Yeah,
Brain fog's
focus.
definitely, yeah, brain fog. Um, if anyone's interested, look on my website. I've got feedback all over the place, and people put what resolves. But I never make promises. I just say, well, if you're not breathing efficiently, let's get you breathing better and see what happens. So.
Wow, it's like a magic wand. Don't know what's gonna what's gonna change. That brings me to the next question. You just mentioned your website. So if someone is they want to reach out to you and they want to find out more, where
Yeah.
can they find you?
So if you just put in breath doc, so breath and then a separate word DOC, Breath Louise, it probably will come up on Google. If it doesn't, it's www.drlouiseoliver therapeuticlifecoaching.com. Bit more of a mouthful. But I've got loads of stuff on there. So I've got, particularly on the menopause page, I've got links to podcasts and conversations that I think are really, well, hopefully are helpful. I've got a pregnancy page, I've got a children's page, I've got a blog post. If you sign up for my subscriber list, intermittently I send out blog posts, and I'm really quite precise on how I reference most of them, and I try to be quite careful of how I do it so it's reliable information. And I've recently had I've done some as a co-collaboration with the blog post. My most recent one I released this week was with two sleep consultants, and they've it's all the nuances of sleep tests, because not every sleep test is the same, and it's a really good blog. So anyone who's a bit confused about sleep tests, that's one to look at.
Okay, good. Thank you. So to end off today's episode, is there anything else maybe that we still needed to cover that you feel is important to mention, or one tip, one thing that you feel like the listeners out there could start doing today or tomorrow? If there's one thing that you could really encourage everyone to do, what would that be?
So I've mentioned a couple of times correct tongue position, but I've not told you what that is. So, and I think that's a great anchor. I really do. So the tongue has a correct position in the mouth, but a lot of us don't know this. So the tongue should be up on the roof of the mouth, as flat as you can get it. So generally that means the first 2/3 or the first half of the tongue up on the roof of the mouth. But the back part won't be able to go fully up there because it's attached to a bone at the top of the neck. And your tongue's flat on the roof of the mouth. The tongue's a strong muscle, so you don't want the tip of the tongue right up at the back of the teeth, because it'll make your teeth go wonky. So where the ridge of tissue is above your teeth, it's somewhere there, the tip of the tongue. Seal your lips, but not clenching. So I can't have my teeth in like contact because I clench, so I just have a tiny gap. And when you put your tongue in the correct position with lips sealed, your nasal breathing, and it's much easier to put the tongue in the correct position with helpful posture. So if people are struggling with the correct position for the tongue, if you make that noise that children do sometimes, like a clickety clap noise, like, so it's when you make a nice sort of loud noise, that's where you've obviously had your tongue on the roof of the mouth to pull it off to make the loud noise, and it's there. Or you can go and it falls in the right place. And that's where the tongue should sit all of the time. So when you're not talking, it should be there, and actually it opens the airway. And if eventually you teach yourself, keep coming back, just keep putting it in the correct position, eventually, as long as your mouth is closed, you'll wake up and the tongue will be in the correct position. But it might take 3 months or more, but it will.
Thank you. What an interesting tip. Thank you so much, Louise. And I like how, breathing is free. It's something that all of us have access to, and it could make such a big difference in the quality of our lives. It's so basic, but absolutely life-changing. So thank you so much for taking out this time to join us today. It was an absolute privilege. Thank you for listening. We hope you enjoyed this episode. Please feel free to share it with friends or family who might find it inspiring. And if you'd like more insights like this sent directly to your inbox, make sure to sign up for our fortnightly HCA Talks Health newsletter. We've popped the link in the show notes. See you next time.